if you see a pop-up menu that are asking that if you want to stay or if you want to leave because of the recording, please click on got it to see the screen. So in today's agenda, we will do the land acknowledgement, and I would like to acknowledge the land that my place of work is within the unceded territory of the Musqueam, Selawat, and Squamish, and the First Nations. There are a few housekeepings. There will be no break. It's a 1 hour session over the Zoom, and feel free to ask questions and use the chat screen, raise hand features of the Zoom platform. The content that we share are starting how to start the advanced care planning conversations, the what, the why, who, when, and how of advanced care planning, information about some of the resources, and keep in mind that in today's session, you will not be writing an actual advanced care plan, because to write an advanced care plan, you need to have more idea about some other concepts such as the advanced directive, uh, the power of attorney, all those kind of things, which we will not be discussing in today's session. The objectives of this session is to give you a brief insight about ACP, help you engage in ACP conversations, explain the steps in ACP, and help you gain information on how to start ACP conversations with the people you matter the most. So, what is advanced care planning? Like, nobody knows you like you know yourself, right? Like, I know myself, you know yourself. But ACP is about having a say and a greater sense of control in your own healthcare decisions, and sharing that information with the people around you, so that if at some point in your life, if you cannot make your own decisions, they will help you to make, or they will make the decisions for you in the event that you cannot do it yourself. Advanced care planning is a lifelong process of thinking about what matters to you, your values, your goals, and preferences, and the care you would like to receive at any stage of your adult life. It's about talking to the people who matter the most to you. For me, talking to my wife is what's important to me. For you, it might be with your partner, your family, your children, whoever it is, and to your healthcare professionals about your own wishes. ACP is a part of life planning, right? It is an essential part of life well lived, like not just lived, it's well lived. We plan for tomorrow so we can live for today. We plan for our finances and estates, right? And then we should also plan for our healthcare. The advanced care planning life planning model shows these things as very important. Like if you plan for your estate, it comes under the wills, your trust, life insurances, and so on. If you plan for your finances, it comes to your savings, retirement savings, investment plans for your education. But then healthcare planning is also important because it will allow you to express your wishes and your goals of care, your place of care, where you should be cared. It should be in the hospital, or a care home, or an assisted living center, or at your own home. You can see a few tabs on top, which is the enduring power of attorney and all, which we won't discuss today. It is a very complex topic. We are planning another few sessions for the same. Interestingly, some facts and figures. 93% of Canadians believe it's important to discuss their wishes for their care with family and friends. But then only 17% have advanced care plan. More than half do not have any advanced care planning in their life, including myself. I haven't done anything, even though I think about it. And I seriously think about having an advanced care plan. If you are interested, we should have a bit of a activity. Uh, let's ask you: do you have any financial plans, Nikhil and Atasha? The other person, I don't know if she was driving, so I don't know if she left or something happened. So even if you cannot answer these questions right now, please think about it. Have an introspection about it in your life, in your own personal space. All right. If you have done any financial plans, if you have done any wills, and if you have any life insurance, I know I had a life insurance in the past, but then I broke that somewhere in the middle because of my finances didn't go right. So, but how many of you have done some advanced care planning? If you haven't done
Uh,
any advanced care planning,
uh,
is that legal?
yeah, I haven't done anything yet. So I'm also planning, but I haven't had any plans yet.
Okay, good, good. So if you haven't done any advanced care planning, why not?
The financial limits that sets, I have some
Uh,
financial limits, so I really can't think about it right now.
Advanced care planning is free of cost. You don't have to worry about your finances at all because it is about your health care. Okay. So
Yeah.
what do you think keeps people from planning for the healthcare? One point you said is your finances. Then what? Natasha, you want to talk?
Yeah, I'm thinking of my situation as well, and I think it's probably a lack of knowledge about
Mhm.
advanced care planning and then how to go about it and um yeah, the steps to do that and what the outcomes are. And I feel like everybody's always so busy, right? And there's always so many things that we put our energy to. So I guess it would be to see the benefit of doing advanced care planning and how it looks.
Yeah, our life priorities decide if we have to prioritize our healthcare also.
Mm-hmm.
For me, it's like I keep postponing my even my doctor's appointment. Can you imagine that somebody who is postponing his doctor's appointment because of some other reasons? So we have other priorities in life, like our family, our job, our education, our homework, our assignment, any simple things in life that comes in, any complicated things that comes to the life, we postpone these these things, and also because of the lack of knowledge. When we don't have that knowledge or the skill that we don't feel confident to take that first step, you know. So you both are right. So let's move on to the next one. Why ACP is important? Nobody knows you better than you do, right? So knowing what's important to you will help you make the decisions about your health. Life can change at any moment. It's very dynamic, right? And hence it is important that the people who mean the most to you knows what you want. ACP helps your family, your friends, and healthcare workers work together to provide the kind of care you want. The earlier the people have conversation about their wishes, the less anxious they are if they experience a health crisis. For me, in my experience, as part of being in a project, many people responded in our surveys that the best place they found to have a start to these conversations is the dining table. When the family comes together, when the mom and the dad and the children are together, they slowly start this conversation. That is the time when in a family everybody is together. Uh, I'm not sure if you have any stories about the impact of having or not having uh, engaged in advanced care planning on anyone you know. Do you have any stories? We have another new member. Uh, we started already. We finished a few slides already, and thank you for joining. So my next question: do you have any stories that impact of not having or having an advanced care planning on someone you know? Anybody? Feel free to share. Nobody. Okay. Actually, I know somebody who didn't have advanced care planning, and then they have to face the consequences because of not having a family doctor as well. When the family member, I cannot tell who, when the family member ended up in a palliative illness, it became a problem for them because there was nobody for them. It's just a mom and her daughter, and that affected her own wishes to be in their home, be in the family, be with her daughter, and nobody was there to take care of her own healthcare wishes, not even for a regular health checkup, because she didn't have a family doctor. And that's the lesson that we all should learn from that, because in an advanced care planning, and Canada being a multicultural country, doctors, we need some healthcare workers. We need doctors, we need nurses, care aides, somebody, compassionate worker, or the personal support worker who can go to their homes to talk about them. It's very important for them to have these people at least to talk about their wishes of how much life they have, how much life they have, how they want to spend their life in quality, and not just about the number of years or number of months they live. They want somebody who can express themselves in their own culture, in their own language. The cultural appropriateness and the linguistical acceptance is very important in a multicultural country like Canada, especially when you are engaging in ACP communications with your healthcare worker. Who should do advanced care planning? Everybody, including myself, yourself, everybody. ACP may be more urgent for the people who think their family may have different views or beliefs than their own. People who have been diagnosed with a chronic condition like the palliative illness, cancer, or early stage of dementia that could affect their ability to communicate. I saw a grandma and her daughter yesterday in one of the hospitals that the daughter took her grandma for a checkup, and then she was constantly shouting at her. The grandma was showing the symptoms of early stage of dementia, but then the doctor wasn't, I mean, recognizing that she was having it, and she was constantly shouting at her. And when the grandma says something, the daughter says something else, and I picked it like that, and then I was just observing them. That's called the difference of opinion. The daughter cannot accept what grandma is saying. So ACP is very important in those situations. When is the right time to do ACP? Some people use key milestones in life to talk about ACP. Some set aside a time each year. For others, the right time is when they find out they have a health problem. Some of the examples that I could come up are when you get married, or you buy a house, having kids, or your living situation has changed, or some of the health events like you are gonna have a surgery or being diagnosed with a heart disease. Uh, some other life milestones could be when you retire, or when you go up in your age. How to do ACP? ACP is not a one-time event. It's a process. It's an ongoing process of thinking, talking, planning, and reviewing your plan. The 5 steps of a, ACP, as they say, there is no right answer. There is only what seems good for you. So Advanced Care Planning Canada has introduced 5 steps for this. It's think, learn, decide, talk, and record. That is think, learn, decide, talk, and record. The BC Center for Palliative Care, which is another organization, when they worked on advanced care planning project, they shrunk all this into 3: think, talk, and plan. But here we are following the advanced care planning steps introduced by Advanced Care Planning Canada. Step 1: think. To think about all these things. You don't have to answer right now. Just think about it in your own personal space. What makes life worth living? That may depend on where you are in life, and your thoughts may change over time. If you are a healthy adult, think about any specific wishes you already have. How to ensure your wishes are honored, and who you would choose to make the decisions for you if you cannot. If you are older and coping with a serious illness or frailty, think about these questions. All right. 1. What do quality of life and comfort means to you? What are you willing to go through for the possibility of more time? How would you like your own end of life experience to be when the time comes? Have you talked enough with those who matter to you and your healthcare professionals about your wishes? Right? That's thinking. Now comes to step 2, learning. Advanced care planning is not about making a laundry list, of treatments you would do or you would not want sometime in the future. But it's about thinking about what's important to you and using that information to inform the health decisions you may make throughout the life. In order to make informed decisions, talk to your healthcare worker. In our case, mostly it could be the family doctor. You need to know the benefits and advantages of all your care options, like how successful different treatment and interventions may be, their side effects. Sometimes, because I'm also doing a cancer research, I know that the cancer chemo, radio, the therapy, and all have some side effects. Some side effects could be permanent. Some side effects could be temporary. Some could be severe, some could be light. It could even affect your reproductive organs. It's a fact. So talk about it. Other possible impacts like hospitalization. What could you do to bring comfort and pain relief? Like opting for any complementary or alternative treatments to improve your quality of life, any exercises, and so on. Think about it and learn about it. All right. Do some research on these things because somebody in the participants said earlier, not having the knowledge is the key of not doing ACP. So learn about it. You using the maximum resources you can get. Step 3, decide. Just imagine, okay? You are walking down the street and a cyclist comes out of nowhere and knocks you down. Just forget cyclists. In Vancouver, cars. Just imagine cars. You get a concussion, and right? Because I've hurt my back. I had this issue. Somebody hit my car from somewhere, and my car was completely total. And ICBC said it's all done. My left hand, the arm, the wrist had a huge bulge, which I carried for almost a year, and my back still hurts. Like I was disoriented and unable to do things. But I know that I can communicate things, right? If you end up in such a situation and you get it, you are unable to communicate or think clearly. You also struggle to answer the doctor's question because my family doctor told me if you are not feeling the pain, it's all good in terms of your bulge. It took me a year to get back into my own home country, take an X-ray scan of my hand, and they found out that there's a slight dislocation for on my thumb bone, and that's why there's a fluid, and that resulted in me having this pulse. But the doctor in Canada told me it's all good, nothing to worry. When I came back, he said he could do a surgery. I said no, I don't need a surgery. I am going for other treatment options, and within 3 weeks, there's not even a single trace of my hand had that bulge. It was my decision to make. In that moment, who would you want with you to help you communicate? I had my wife and friends with me to communicate. Even though I didn't have any advanced care planning, but I communicated it to my wife and my friends, and they absolutely said, no, we don't need a surgery. And I agreed to it. If you are unable to make a decision for yourself, you need someone to speak and decide for you. That person is your substitute decision maker, or commonly known as SDM. Am I clear? Do you have any questions? Okay, let's move on. So, how to choose a substitute decision maker? When choosing a substitute decision maker, ask yourself, who knows you? And what gives your life meaning, joy, and purpose? Who do you trust to respect your wishes and make decisions you would make for yourself? What are you comfortable talking to about sensitive and difficult issues? Who would be able and willing to make difficult decisions on your behalf? Who could honor your wishes even if those wishes differed from their own. Say, for example, if Nikhil and his partner has a difference of opinion, even if his partner has a different opinion, and if Nikhil has an advanced care planning written, that partner is bound to respect his wishes and implement it. Simply stated. When choosing a substitute decision maker, try to choose someone who is a capable adult, who will honor your wishes even if they are different from their own. This is their legal role. This is not just a fancy interest or wish or something. In British Columbia, it is illegal, and the substitute decision maker could be punished or face some penalty if they don't honor the wishes of the person who wrote the advanced care planning and has made you a substitute decision maker. That person should be calm in a crisis, is able to handle conflict or disagreements. Like example, family members do not agree with your decisions, or your substitute decision maker may not agree with the options provided by your healthcare worker. In those conditions, when there is a disagreement, try not to have conflicts. That person should be able to handle it, and that person should be accessible and be able to commit the time that might be required. There's a certain amount of time that is required, so that person should be able to find time for that. What happens if you cannot communicate? In the event that you haven't chosen a substitute decision maker, this is where what happens. If you have not chosen someone to be your SDM, or that SDM is not available, your healthcare professional will turn to the other people in your life in the order they are listed in your province or the territory. The resource that I've given here will take you to another link, which I will share with you after the webinar. That list is basically starts with the most important and immediate person. If you have a partner, that partner will be first on the list. Then the list progresses like that. That the partner, if I'm guessing right, the children, parents, friends. If nobody from that list works, then the public guardian and trustee comes to play and find you a substitute decision maker. That's all very a bit of a very complicated stuff, but we will have more sessions for that. Next is step 4. Talk. Think about the people who matter most to you. How well do they know you? It is important to talk about your wishes so they know what's important to you, and because your wishes might change over time. My wish for today is I want to go for trekking, and my wish for tomorrow would be I just want to sit under a tree. I might go for a walk. When we did the advanced care planning project among the Chinese and South Asian community, they stated confidently and solidifying their information that whenever they were the substitute decision maker for their mom, their dad, their grandparents, every day their wishes change. Or literally, like when they wanted to be in a care home at their end of life, but when they reach that age, they might think, I just don't want to be in a care home. I just want to be in my home with my family. So at that time, they go back to the advanced care planning and they change all that. So the substitute decision maker should be able to know all this, and in case their wishes change, they are bound to take care of that as well. Who? Your substitute decision maker would be somebody from the family, friends, anybody in your close circles, or a mature adolescent. And why? They are required, they are needed to prepare everyone to support your healthcare decisions, to help them make decisions that reflect your values, goals, and wishes, and to have others who matter to you support your substitute decision maker. What are the things important to you? Have you thought about that? The substitute decision maker should know what is important to you. What are your goals? Your biggest fears and worries? Who will speak for you and how you want that person supported? How you do it? Pick a time when you feel relaxed and you all have time to talk. I said during a dinner or a family outing, to a walk in the park. Choose a place where you are all comfortable. Start by discussing the present right now of it. Don't start from the past. Like, I've been sick or I've been bedridden or I've had serious cancer problems in the past. So I want to talk about something that could happen in the future. Don't start like that. Start with the present. We are all having a happy family. Now that we are all together, uh, I would like to talk about something that is very important to you and in my life. These are some of the examples that I'm sharing. Talking about the present, it does not really mean you have to think about something great, something good, something that big. No, it could be something very simple. There is no right answer or wrong answer. Just speak. Talk to your healthcare professionals as well. Why? It is important because you are more likely to get the kind of care you want. Your wishes may change over time and you want to be sure that you receive the care which is right for you. What? Tell them your wishes for your current care to your healthcare professional, not about your past care or something might happen in the future, about your current care. Who your substitute the decision maker is. Any other information they need to follow in your wishes. Sorry. Yeah, sorry. I just scrolled my mouse accidentally. So what to tell these healthcare professionals? Have you thought about that? As you age, or if you have a chronic or serious illness, some of the things that you might want to talk to your healthcare professional is what is important to you, what living well means to you, what is quality of life means to you, how and where you want to spend your time, what treatments you are willing to undergo for the possibility of more time. And as you near the end of life, like everybody would near our end of life, it's an inevitable process that we need to accept and move on. I know it's not a simple emotion, but advanced care planning also gives importance to end of life care. So as you near the end of life, where we would like to die, I would like to die. What circumstances would change and my preferences, how my family and our healthcare workers can prepare for this. right? Any questions so far? Have you got it something? Because I will be sharing the slides after this session. Okay, let's move on. This is very interesting. This is a conversation starter. The hardest part is starting the conversation. It's like, say, for example, just like I quoted a while ago, I heard your help for something. I was thinking about what happened to my name, Thomas. My name is Thomas, and it made me realize that I need to have something written about my healthcare wishes. Right now, I'm living with, say, my back issues, and I expect a prognosis. Is that what you have understood? These are things that we could think about starting a conversation with the family, with the healthcare worker, with anybody that is close to you. Now comes the last step of it, which is a record. So Nikhil and Natasha, you might have learned somewhere recording is important in any work-related stuff that you do. Can you quote me a few examples?
Can you ask the question again, Thomas?
You might have done any recording in your life, in your work, in your personal life, about your activities and so on. So why do you think recording is important?
I feel like your mind can change a lot depending on what state you're in. So that could be pretty relevant to your health. So if at one point you felt a certain way and then you got sick or things changed, it's a good way to go back to some way that you felt at another point that you just might not be able to remember now.
Exactly, like a reference point, right?
Mm-hmm.
Nikhil, what about you?
Recording, yeah. I'm professionally a nurse, so I think it's important to record whatever I hear and whatever I do. So it's legally important.
Hmm? So you're a nurse. Nice.
Yeah. So legally, it's accepted. The recordings are, I think.
Have you encountered any issues like that because you recorded that and then it became helpful after some time?
Yeah, in so many, I have experience like in so many cases, like I had the patient may say something else, so it's important to record whenever I do something, any procedure, like any procedures or anything.
Okay, great. So just like you guys said, why it is important. There is no legal requirement to write down or record your wishes, but recording can help because if you don't record anything, verbal things don't count in most cases. Say, for example, as you both pointed out, there is a limit for you to refresh your mind, go back, think about what you said or the patient said or somebody else said in the past, and quote that somewhere. But then if you record it on paper, you have evidence that this thing happened. So this is what we are going to do, right? Say, for example, in advanced care planning, the wishes of your dear one was not recorded in case. In case it was not recorded on paper. Just an example. That person started having dementia, and it started showing early symptoms of it. Somehow, due to our family uh, being so busy in life, we forgot to record it on paper. That person's wishes. Eventually, that person went from mild to moderate level of dementia, and to a stage where that person cannot remember anything. At this point, you cannot record anything at all, just to follow what happened. So, because I've been with dementia patients when I was in my home country, did some volunteering activities for them. It's just to be there for them, observe them, give them some company. These are the things that you can do. They are literally not able to communicate to you, or you cannot communicate to them what is required. You remember what you thought and said, right? Your substitute decision maker remembers the details of the discussion that happened and provide evidence of your wishes if there is a degree, that there is a disagreement about your care. And what are the things that you record? Documentation or voice or video recording of your values, goals, and wishes. A list of potential substitute decision makers, and any legal documents such as the advance directive, representation agreement, enduring power of attorney. These are things that we will discuss in the future webinars. I just told you these terms for you to remember or to go back and read about it. How would you record? Whatever works for you, you can record. Use the speak up template and record. You know, in your phone, use the recording feature to record. Record a video. That will be much better because in the future, that person also would be happy to see that face on video, right? Write a letter. You know, store any documents in a safe place. Give a copy to your substitute decision maker, people who matter to you, and your healthcare workers. There's a legal requirement based on each province that you are in. In BC, it's different. In Ontario, it's different. In Alberta, it's different. So that comes to a bit of a review of what we discussed so far. Remember, ACP is not a one-time event. It's important to review your ACP regularly. Why? Because to understand your health and treatment options, and it can change over time as your values and goals and everything. When to do? Whenever your life, health or circumstances change, whenever it is. How? Use the same 5 steps. Think, learn, decide, talk, and record. If anything changes, tell your substitute decision maker and the people close to you. Final wrap up. Think what is important to you. Learn about healthcare options. Decide who will speak for you. Talk to family, friends, and healthcare professionals. And record your wishes and share them with the people who need to know whenever there's a change in your life or health. I have a 2 small 1-minute videos to show you, like 2 videos. It talks about a briefing about whatever we talked today. Right? I would like you to stay for another 5 minutes. We will wrap up by then. All right? I'm going to share that video with you. Hold on. I'll be back just 10 seconds. Can you see that?
Yeah, we can see it.
That's what. Yeah. There's another one. Okay, I hope you enjoyed those few videos. Here are some resources for you to keep track of advanced care planning that I talked to you about. I would also recommend the first one for sure. That's where I work in the advanced care planning project. They have some amazing resources that you could always go back and refer. And also, uh, uh, surely refer you to the NIDA's personal planning resource center for representation agreements and people's law school. The government of Canada, the British Columbia government, and Fraser Health has their own advanced care planning resources, and Fraser Health has a toll-free number, which if you would like to talk to them about your advanced care planning or anything that you would like to know, please feel free to call them at 1-877-825-5034. And there is an advanced care planning BC workbook, which will give you an idea about how to write your advanced care planning. It's simple. It's like you don't need any template or reference points to write an advanced care planning. Just take a white sheet, write your name, write your wishes, how it should be done, think about it, record it. That's it. Who should be your substitute decision maker? Keep it in a safe place. It's like writing a letter or writing a poem. You don't need any specific template, but Still, the government of British Columbia offers a template of how you can do advanced care planning. Please feel free to check all this, and I will share this slide with you. And I would like to sincerely thank the generosity of Advanced Care Planning Canada for providing us with the resources to conduct this webinar. You will receive an evaluation form, and please fill that because it will help me conduct more sessions. Because this is the first session I am doing about advanced care planning, it will help me learn more, come up with new topics, and have more audience, the participants, and hopefully we can have bigger information. It will really help me go forward. And one thing I would like to quote here is advanced care planning is a very tough topic. It's a very hard topic. Normally, when there's a subject like this, people never show up. People don't show up because of the nature of the session, the terms that we use, like end of life, dying, and which are the things that people in Canada would like to avoid talking about in the regular day, But then you guys showed up. There were two others, but unfortunately, I don't know what happened to them. They left the session. Maybe they are busy. Somebody was driving. But I thank Natasha and Nikhil for being here all this time. I hope you guys learned something, and your certificates will be emailed to you. Just give me until the weekend. It should be emailed to you next week. Meanwhile, please send me your evaluation also. And if you would like to quote a comment here in this session, I would be open to your comments about how did this session go. Would you like to give me a feedback right now? Natasha, Nikhil, would you like to say something about the session? If you have any questions or comments?
No questions for me. Thanks a lot, Thomas. That was really helpful. I didn't really know much about ACP coming into it, but you sharing like all the resources, and I looked up a few of them as we were going through the webinar, and all really good links. So thank you very much for all the information. And if you need anything from us, so you said to was there a place that we could provide feedback or anything, or is it kind of just right now?
I will send you the email. I have your email when you registered it on Eventbrite.
Okay. If anything, I'll fill that out with anything that I can think of. But that was really great, and great job on your first webinar. Congratulations.
Thank you, Natasha, for your kind feedback. Nikhil, would you like to say something?
Thank you, Thomas, for telling me about the ACP. I didn't really know about what the ACP, and I think I got some idea. And thank you for sharing this. And once again, congratulations for your first webinar, and it was really wonderful.
Thank you, Nikhil.
And yeah, I'll definitely evaluate it, and I'll send it to you.
Thank you. Okay. So please kindly follow us in our social media channels for more regular updates.
Yeah,
and thank you for your time, and enjoy the rest of the day. Have a good weekend, great weekend. Enjoy.
Thank you. See you again.
Thank you. Have a good weekend, everyone.
Thank
Bye.
you.
Thank you. Bye.